everybody, welcome back to another episode of HealthSparx, featuring the brightest entrepreneurs and innovations from the health technology arena. I am Michael Walsh, your host. So glad you could join us for another fantastic episode. My guest today, Dr. Don Dizon of Massachusetts General Hospital. Say that 5 times fast. Dr. Dizon is an oncologist up there doing some great work. A very passionate guy, loves to really help out, not only with cancer patients, but he really focuses on that after piece of it as well. Once you've kind of had your treatment, he's one of those docs that actually gives 2 shits. He's actually going to follow along, make sure that you're getting what you need, and help you with any way he can after the fact. So great guy. Got connected with him here in the last few weeks as he joined a previous guest of mine, Amy Ohm from Treatment Diaries. She runs a tweet chat every Tuesday night, I believe, at 7 p.m. So a quick shout out to you, Amy. Woohoo! Keep hustling. Met Dr. Dizon and got to chat and said it would be great to have you on the show to talk all about what's going on with healthcare, with cancer. What can we as patients and family members be doing to be better prepared for this, and just sort of maybe also get some feedback on his outlook for healthcare just as we go through this big transition phase we're in, and what technologies and what platforms he's really interested in and what he's excited about. So really looking forward to the episode today. This should be great. It should be good stuff to share for everybody to learn about, and hope you enjoy it. So before we get into the show, of course, reminder that it'd be great if you could subscribe to HealthSparx right here on the website, or go to healthsparx.com/subscribe. Just my way to deliver episode content to you every Tuesday morning. We've had some fantastic guests from all over the world. I've had people from Canada. I've had a guy from Australia come on. Incredible founders and entrepreneurs here in the United States doing some awesome work in the space. All stuff that we need to know about and start using, frankly. So that's what I do every Tuesday morning. So by subscribing, you get this stuff delivered straight to you. No spam, no BS, just good content. We're also, very active on Twitter, so follow us there. And of course on iTunes and Stitcher Radio as well. So without further ado, let's get into it. Me and Dr. Dizon. All right, people. Today on HealthSparx, I'm joined by Dr. Don Dizon. Let me quick jump through his bio here before we get started. Dr. Dizon is board certified in medical oncology and has interest in the treatment of women's cancers, sexual health and survivors, and cancer survivorship. He is founder and director for the Oncology Sexual Health Program at Massachusetts General Hospital. Dr. Dizon's research emphasizes his commitment to new treatments through his work with the Brown Oncology Group and the Gynecologic Oncology Group, where he is a member of the Phase 1 Cervix and Developmental Therapeutics Committees. Dr. Dizon is also deputy editor at Up to Date, which brings him in contact with national and international thought leaders to develop content that is most relevant, timely, and useful for point-of-care medicine for several different types of cancer. So, with that being said, Dr. Dizon, how are you, my man? Welcome to the show.
Thank you so much. It's good to be here, really.
So let's jump right in. I'm curious just to kind of get to know you a little bit here and let the listeners get to know you. As a physician, why focus on cancer?
Well, that's actually a very good question. I think there's a lot of folks who can't understand the career choice because they see oncology as something very scary and dark, where most people don't survive it. I went into this with the exact opposite view of the disease and its treatments. I found an opportunity where I could actually make a difference in people's lives. If I could just even move the field forward just a little bit in terms of novel therapeutic strategies, and then, more and more it became how to improve the quality of life of people after they've been treated.
Sure.
And I've gotten really interested in just humanistic aspects in oncology about communication and end-of-life issues. It's the whole thing. It's taking people at their healthiest, taking them through something incredibly scary, and then seeing them go through the other side. And sometimes that other side is a long-term survivor, and sometimes it's someone who's dealing with metastatic disease, and you're helping them deal with real issues, and that do often culminate in their death of that cancer. But it's a journey that it's an incredible privilege to be a part of.
Absolutely. And you know what? I have this conversation with people a lot in healthcare, and we talk about this concept of patient engagement,
Yep.
what the difference between just like, actually patient engagement versus just like patient experience and some of these things. And, the thing that constantly comes back up with patient engagement is having a physician that actually like exactly what you just said, someone that is there with you, not just treating you, but is on your team, that is there at the beginning, during, at the end, and is just willing to sort of be that person that wants to be on your team through the whole thing. So yeah, kudos to you, my man. That's awesome that
Thanks.
you've chosen to be part of this. Like, and you're right, it can be sort of a dark area, but a lot of opportunity if it was the right person.
Right, and more people are surviving their malignancies, so it's actually becoming what, we had hoped. If we can't treat to cure, can we treat it so it becomes chronic and someone doesn't have to die of their malignancy and see all of these, these events that are so important to all of us and fulfill their bucket lists. I mean, it's becoming more of a possibility that that's the reality for a lot of people diagnosed with cancer.
Sure. So to that point, I mean, let's pretend for a second that I'm a patient or I'm the family member of the patient, and I sit down with you at coffee over at Starbucks, and the first question I ask you is what makes a good oncologist? Well, what do you tell me?
I think honestly it starts with familiarity with the disease and also a very contemporary understanding of where it's going in terms of treatment. So it's not enough to just say, well, this is what everybody does and this is what you're going to need.
Hmm.
A good oncologist should really be able to paint for someone in very clear terms, this is where we are, this is where we're going, and this is what we think we're going to be able to do.
Right.
So it brings up standard of care. It talks about clinical trials in that specific situation, and it goes through what can I expect afterwards.
Sure.
So it begins with data, and then it sort of has to morph into personalized medicine to sort of this, okay, so now everything that I've told you, how can I help you make a decision? You need to tell me about yourself and what you want to do and what's important to you. And then trying to provide that filter so someone can take all of this information you spew and make it relevant. And I think that's what makes a good oncologist.
How long have you been practicing oncology now?
Over 10 years at this point.
Could you recall what maybe like it could be a particular case or situation, something that you're most proud of over the last 10 years?
Oh, let's see. Probably it would be my work in survivorship has actually been something that I've been the most proud of. I didn't go into oncology with an eye towards doing anything in survivorship medicine. It was more about my
Treatment.
field of interest and passion was really novel therapeutics in
Yep.
gynecologic cancers. But seeing that niche, and it's a growing niche, fortunately, but just seeing what's going on with folks after they've been diagnosed and treated and realizing life is very different.
Hmm.
And they talk about this concept of near normal, and we don't do a good job in oncology about how to navigate a new normal. And certainly we don't do a great job about how to navigate interpersonal relationships, intimacy, and sexuality. And so I think my contribution that I'm most proud of right now is my work that I've done in sexual health.
Awesome. So
Yeah.
let's take a little bit of a broader view now of the whole thing. So from the point of view of a physician, as we talk about the healthcare industry, a lot of change going on right now. In your
Yeah.
opinion, how equipped is our healthcare system to handle the growing load of patients and their families with cancer?
Well, I think that's the biggest dilemma. There's projections that cancer cases are going to continue to increase. Probably it's going to be an increase in patients being diagnosed with earlier and more curative stages of their disease. But since we're also having success in our treatments and having far more survivors of cancer, there is a big issue of how to take care of people as they come into the oncology system and those who are ready to exit but may not want to exit that oncology system. So I think one of the biggest barriers is going to be a lack of oncologists, probably projecting into the next 10, even 20 years,
Sure.
and how to meet the needs of patients no matter where they are in that journey. So, when you couple that with what's going on with the whole movement of really trying to deliver precision therapies where you're not only looking at a tumor type and a stage as we would traditionally, but you're looking beyond that. You're looking at what gene is driving this cancer and what treatment will silence that gene to put this person into remission.
Mm-hmm.
It's a lot of data that's being generated. There's a lot of hypotheses and there's a lot of drugs. So the discussions are going to get more complicated. There's going to be less of us to really do that conversation for the folks who would need it. And then we don't necessarily want to abandon care for those folks we've helped see through that process. I mean, part of my day is really seeing folks who are doing well after treatment. It's something that motivates us, but clearly something's going to have to give.
I'm not sure how you feel about this, but I'm a big believer in, patients and families doing some research and some homework up front.
Yeah.
That's part of the problem here too, right? I mean, to your point, there's going to be a shortage of oncologists. There's a lot of people coming in. Cancer's growing. Part of the problem that people keep talking about, and I agree with, is that patients and their families, it's a fire drill when something comes up, right? Like they're unprepared. They're completely unversed in how the healthcare system works and how the disease works. So what can we all do as patients to better prepare for situations like dealing with cancer? I mean, can you prepare for this?
Uh-huh. Well, I think you can. There certainly is enough tools that are available in social media. There's enough tools on the internet, and there's enough really great resources, just for basics and background from the American Cancer Society for any specific tumor advocacy groups where they can give you the basics on where to go. And then if you couple that with clinical research databases like clinicaltrials.gov, a family member or even a patient or their social network can really identify, what should we be talking about when we go in there. But I think the problem is it becomes so overwhelming and you start getting filtration by folks who may not necessarily be the most appropriate to speak about a cancer.
Mm-hmm.
So you start hearing about, my friend traveled to China and did this treatment, or I've heard about this thing and it's on the internet and it's supposed to cure cancer, so you should look these things up too. So part of that is trying to filter the noise from the data that's probably going to be most relevant to you. But it's clearly something that can be done. And probably the most helpful discussions are where the patient has gone over the shock of hearing they have cancer, may still have the anxiety because they don't know what's going to happen, but have sort of tried to harness that anxiety by doing some homework, coming equipped with questions, and if not able to do that, at least coming with others so they're not alone, so they can also have external ears and advocates to help spur that discussion forward.
Right, and that's where platforms like, I know you and I kind of got connected after that tweet chat a few weeks ago with Amy Ohm and Treatment Diaries. That's where a platform like Treatment Diaries comes in handy as well, like being able to go do some research and actually read about what, other people's experiences may have been.
Right.
Just to, at a very minimal level, try to understand from the personal point of view as opposed to reading some white paper on it,
Right, and I think it's more important. I remember 5 years ago when a family friend was diagnosed with melanoma, going into the internet was scary because the only people who posted were those people who weren't doing well.
Uh-huh.
But I think we're in a different age and there's so many different types of supports available, so many different types of communities. If you look at Living Beyond Breast Cancer, they have a group for young women. They have a group for women with metastatic disease. They have a group for women with early diagnosed breast cancer. There's a group for women at a genetic risk of developing disease. So I think, one should really try to find the group that speaks most towards that situation. And it's a problem, particularly with gynecologic cancers, where you type in women with cancer, you got 18 sites dealing with women with breast cancer, and maybe not so many for women who've lived through ovarian cancer. But I think these are starting to pick up, and you're starting to get this community going, and it's both very specific but also very general. I think both of them are helpful.
Absolutely. So let's talk a little bit about some of these things that you specifically are working on. Again, you do a lot.
Yeah.
So walk me through some of these, some of the most exciting projects you're working on, and kind of let me know how can these projects benefit patients and their families.
Well, I think that's dependent on what the project is.
Sure. Yeah.
Um,
So pick one. Walk me through one of them. Again, I'm reading through the bio, and I had to cut it down. There was like 5 or 6 different projects you're involved with.
right.
So
Well, I think you go from the oncology sexual health clinic and focusing on issues of sexuality and intimacy. For the women where it's a concern, one of the biggest ways we help is to try to make sense of what's happening because it's not intuitive.
hmm
Therapy and even a diagnosis of cancer, even before they were diagnosed with cancer, some things may have changed or shifted within their bodies, and all of a sudden the way they were responding to stimuli was different, or maybe their intimacy was suffering because they weren't feeling very sexy.
hmm
And just showing women that what is happening is normal, and B, if you try to contextualize that experience into something that finally makes sense, it's like a cloud lifting. So even beyond, sexual health therapeutics, just providing a forum where someone can actually come and talk about these issues in a very safe space, knowing that you're not going to make the clinician uncomfortable, and the clinician is also going to respect where you are in terms of who you see yourself as a sexual being, I think is important. And I think I've seen enough people get help and in fact have relief just with this kind of clinical visit. It's been very rewarding. Now, if you look at the work I do in clinical trials, then I think that's the only way we're going to, push forward in trying to get better therapies. And, it was in one of the London newspapers had this headline about a patient being a guinea pig in order to get a vaccine on a trial. And, I think that is not the picture I want for my own patients when they're being approached about trials. And,
Sure.
I've had enough of an experience where, I enrolled the studies that looked at trastuzumab in the adjuvant setting. And, I had 2 women. One was randomized to no trastuzumab. One was randomized to trastuzumab. The woman who didn't get trastuzumab developed metastatic breast cancer. And we talked about the fact that she didn't get trastuzumab, and it was a positive study for the use of trastuzumab in the same setting. And her response was so telling. She's like, well, it didn't help me, but I think I helped a lot of other people. So
Sure.
there is that sense that trials matter, but you
hmm
have to put yourself on the line, and you have to be willing to add to that, groundswell of progress. And one of the biggest things I think about are those 2 women and the contribution they made to future generations of women who may be diagnosed with breast cancer, and even to their own families, and knowing they made a difference and that they were actually trailblazers. So that's
Right.
how I see clinical trials, and I think that's how we can help. If you look at the work that we do at Up to Date, it's really trying to get the most contemporary understanding of whatever the clinical question is, and provide a sound rationale as to why clinicians should do or maybe consider doing in action A rather than action B. And I think the fact that we're able to incorporate, clinical data with a rapid turnaround, it's rendered, medical textbooks fairly obsolete, because we can change the approach to any cancer fairly quickly to reflect the most contemporary viewpoint. So all of these kinds of projects are really important. I still do a lot of editing. I still do a lot of clinical research, and I think it's all really important in order to both, contribute to the literature, but also to help train a new generation of oncologists. And that's the other thing that I like to do.
Yeah, and I'm sitting here as you brought up to date, and
Yeah.
it's been a while since I've been to this site, and I
Yeah.
had no idea that you were involved, and so
Yeah.
we met here recently, but this is an incredible resource. I
It,
mean, like, there's so much here.
yeah. I mean, it covers the gamut.
Yeah, I
Of
mean, and it clearly
medicine.
lays out right here on the homepage, like what the benefits are to everybody,
Yeah.
institutions, clinicians, patients, librarians. I mean, you name it. If you need something, like, it's here, kind of thing.
Yeah, it's a resource. It's very easy to get your hands on the most contemporary review and get get a suggestion by experts in whatever field. And yeah, for me, when I use this in clinic, I don't read up to date and say, okay, that's what we're going to do, but it gives me a great starting point, of where that discussion needs to go.
Sure.
And I think that's really, really valuable.
Absolutely. So a couple of last quick 30,000 foot questions for you as we finish up. So as we look forward, I mean, we talked a little bit ago about just kind of the growth in cancer and where things are going, over the next 10 years with, the number of oncologists and all that. But looking at healthcare in general over, let's say, the next 5 years, what are you most excited about personally?
Well, I think I am excited about the promise of precision or personalized medical therapy. I'm hoping that we can, really, um, incorporate all this data that's coming out about the genomic backgrounds of cancers themselves, and maybe get to a point where, we look at a tumor based on what its genes have told us about what mutations are driving it rather than where the cancer itself had started.
Mm-hmm.
It would be a huge achievement if we were able to, say, oh, okay, well, this tumor is expressing a mutation in c-KIT, so that means we need to use these types of inhibitors, and they're all orally available. I mean, part of it is to try to deliver less toxic therapies is a huge goal, but I think we can get there, and I think this partnership between patients, advocates, journalists, social media, clinicians, and pharma is going to probably revolutionize the way we study drugs, get those drugs approved, but also increase the view of what drugs should be held to define success. So it's going to be the incorporation of patient-reported outcomes, for example,
Mm-hmm.
and long-term toxicity data. And that's going to be the risk-benefit ratios that we're going to probably have to start dealing with when we're talking about therapies. Say, so if the benefit is 4 months, but the risk is heart failure in 10 years, how
Sure.
do we make people understand these and balance them out? And I'm hoping that this whole area of decision making will also grow up more than it's already done.
Yeah, I mean, and
Yeah.
you mentioned the stakeholders involved, the
Yeah.
patients, the clinicians. I mean, and again, without a good, steady set of data that is accessible to all those parties that can facilitate a good communication between, that's what really also is going to make a lot of that possible, what you just described. So
Yeah,
very, very important.
I agree completely. Yeah, I mean it's going to be driven by multiple folks, and unfortunately, or fortunately, I should say, it's going to be out of the hands of clinicians exclusively and out of the hands of just pharma themselves to influence what trials we do,
Hmm.
and how we interpret that data. Yeah.
Absolutely. So wrapping up here, I mean, what advice do you have for people out there as they work through kind of the pain points of our healthcare system and fighting cancer?
Well, I would say, like you had mentioned earlier, Mike, do your homework and understand the background of what you're going to be discussing with your doctor or your clinician. Don't accept one opinion. Um,
Hmm.
it's always valuable to get a second view at the same data, and get a different take on, what approach is reasonable, what alternative approaches might be available. And no physician ever takes it as an affront when any patient says, I'm going to get a second opinion. I want to see a patient, and they should feel empowered to ask the questions that matter to them. And it's always going to be better if you are a partner in your care as opposed to asking a physician to make all your decisions. At the end of the day, I'm not the one who's going to take therapy for anybody. So, I'm hoping that when we decide to embark on a treatment, that patient is doing it because she feels it's the right thing for her. And I think that's the most important thing, and that's my measure of success.
Awesome. Well, I can't tell you how much I appreciate you taking the time to join us today and chat all about this stuff. I will be sure to, right here on the episode page as I post it, share your contact
Yes,
information and
please.
share your bio and talk
Thanks.
about all the good work you're doing. So Again, thanks so much for being here, and all the best to you up in Boston.
Yeah, really appreciate it. Thanks a lot, Mike. Take care.
And that is a wrap on today's show. Thanks again so much to Dr. Dizon for being a part of this. This was incredible. I especially love this last part here where he started talking about how, as patients, we also have a bit of a responsibility here. It's not just on the doctor to have all the answers, it's partly our responsibility to do our due diligence and our research and come with good questions so that when we walk into that doctor's office, we can make the most of the time. We can actually get the answers we need as opposed to starting from scratch. And, a lot of physicians out there would probably not be saying this because, they want to be the one to kind of control the situation, but not Dr. Dizon. He's like, no, do your research, do your homework here, come to me prepared and prepare to have the best possible outcome that we can put together, as a team. And that's the mindset, hopefully, of healthcare as we go forward here. That's how this is supposed to work. So a fantastic example of that, and I thought he was an incredible guest on the show today. So even one more time, thank you so much, Dr. Dizon, for being here. You're awesome, dude. So before we wrap up, again, a quick reminder to subscribe if you haven't already to HealthSparx, healthsparx.com/subscribe. Just my way of pushing all the great episodes and content, tips, anything from guests that comes up either before, during, or after the show. I share through the mailing list. So definitely subscribe to that. Available on Twitter. Definitely available on iTunes and Stitcher Radio as well, so you can check us out in those forums. So hope everybody's having a great week. And until next time, I'm your host, Michael Walsh. We'll talk to you soon.